What's up YouTube, and welcome to another video. So today we're going to talk about mouth breathing, which sounds like a pretty innocuous topic. Like, why is mouth breathing so bad for you? It came to my knowledge that calling someone a mouth breather is actually an insult nowadays. And there's a lot of reasons why it's bad for you, and that's what we're going to uncover in this video. So if you are a mouth breather, if you wake up with a bunch of drool on your bed, if you just hate breathing through your nose or just can't, you're gonna find a lot of value in this video. Alright, so why is mouth breathing so bad for you? So there's a list of reasons why it's bad. Starting off is, at first, it dries out your gums. So obviously when we're breathing through our mouth and not our nose, this exposes our mouth to the air and it dries out all the saliva. And saliva is really important to prevent cavities because it reduces bacteria in the gums and in the teeth. And it could actually change your mouth bacteria over time, increasing the amount of bacteria that you have. Believe it or not, it also changes the formation of your face. So mouth breathers generally have a more narrow and undefined jawline. You see, when we breathe through our nose, we have nose hairs that their function is to filter out pollutants, small insects, allergens, and debris. But when you breathe through your mouth, you're inhaling all of that in. So speaking about the appearance of the face, it could also cause orthodontic problems, such as an overbite or an underbite. Or it could cause teeth deformities. It causes enlarged tonsils because your adenoids are exposed to air at a more frequent basis compared to nose breathing. And since it dries out your gum and saliva, this also is going to contribute to bad breath.
Excuse me, sir. I hope my horrible ugliness won't be a distraction to you.
Not at all, boy!
And it also contributes to chronic stress and anxiety.
The term mouth breather is a really interesting term, right? Because it's a term for a moron. But I felt like a moron. Like, after I got my nose fixed, I was like, why didn't I do this before? Like, I was robbing myself of oxygen.
About 25 to 50% of the population habitually breathes through their mouths. And they don't realize the neurological problems that this causes, the respiratory problems this causes, problems with snoring, sleep apnea, even metabolic disorders. I mean, it goes on and on and on.
So for the worst case scenario, if you have enlarged tonsils, this is going to make it really hard for you to breathe through your nose. So you might have to go through the surgical route and get a tonsillectomy. Or if you have a deviated septum where you could only breathe through one nostril, you could also get a septoplasty to be able to breathe through both nostrils unobstructed. Also, check to see if you are allergic to anything, such as dust, dairy, and pet hair. This is a big one because when you live with pets, some leave out hair more than others that could contribute to stuffy noses. So don't let your pets sleep with you. I know you love your furry little animals, but your health is more important at this point. And since pets let off a lot of hair and dust, this will block your nasal airways and will make you more likely to mouth breathe through your whole sleep. So make sure to vacuum way more often if you do have pets. And also go to the doctor to check to see if you have enlarged tonsils or adenoids. And they'll give you a recommendation what to do after that. Another important tip is to maintain good tongue posture. So you're probably thinking, I know what good posture is, but what the hell is tongue posture? So you want to have the back thirds of your tongue on the roof of your mouth. So a good tip for this is act like you just swallowed something. So once you swallow where your tongue ends up, you want to maintain it like that at all times when you're obviously not talking. So this is going to prevent any facial deformities and prevent mouth breathing as well. You can also use nasal sprays or a neti pot to clear up those airways. And also when you're sleeping, if you sleep on your back, you're going to be way more likely to have your mouth open because of simple gravity. So sleeping on your side will help if you are a mouth breather. And obviously when you're sleeping on your side, make sure to have a pillow in between your legs to keep an aligned spine. Personally, that's how I sleep. I'm a side sleeper. I used to sleep on my stomach, but my neck would be contorted in a weird way and I'd wake up with neck pains. So sleep on your side because that'll put less stress on your lungs when you're sleeping on your back. Personally, I don't know how anyone could sleep on their back. I feel like I'm in a coffin sleeping on my back. So I hope that you don't have to go through the surgical route in fixing this, and these small tips helped you out. So if you learned a thing or two, make sure to smash the subscribe button for nutrition and lifestyle advice. And as always, I'll see you in the next video.